So I'm up here with Carly, who's a patient partner, and we're going to talk a lot about the patient voice and patient engagement. And I just wanted to thank the Academy and several of the other people that made that possible today, so Pat and Eve and Gavin and others, to make sure we have that voice represented. So I'm going to quote someone who was just speaking, Dr. Pat McGraw. Pat, when I started in the field of pain about 9.5 years ago, one of the first things I saw was Pat give a talk at the International Symposium on Pediatric Pain for his outstanding contributions to the field. And what came out of that was a paper he published in Pain about the modern history of pediatric pain, some of which Bonnie touched on already. And Pat aptly titled this paper, "Science is Not Enough." And I really think that's important for us. And this is a quote from that paper, that without science, the public outcry, in this case, a mother's voice about how her premature infant had significant surgery with just paralytics and no analgesia and was fully conscious. Without her outcry, without science, that public outcry, that mother's voice, wouldn't have shifted necessarily things as we move forward. So we really need that scientific evidence. But without that public outcry, that scientific knowledge can live in a vacuum, right? And it can just stay there. And so I think this ties also into Bonnie's discussion about how we need to move that forward. So these two things, I think, really need to marry what happens next as we move the chronic pain agenda forward in Canada. So many of you here as Canadian scientists have certainly heard about patient engagement, particularly as Canadian Institute of Health Research has certainly promoted this work. And Maria said this morning, so nothing about us without us. And so research is really, in patient engagement and research, is really about bringing that patient voice into partnership in the research process as part of research teams. And that happens across a continuum. So traditionally, health research has really stuck towards one end. We teach patients about what we've learned in science. We have them participate in our research studies, but we really need to move across that continuum, and we are starting to do this work, to moving that expert patient voice into consultation, involvement, equal partnership and collaboration on research teams and in the research agenda. Also moving that even further to have patients be leading, and we as scientists and care providers in more of a supportive role to take their voice forward in a meaningful and evidence-based way as well. So we're here to talk about one way we're doing that in chronic pain in Canada, and there certainly are a number of others who are doing this as well. We have a CIHR-funded patient engagement project where we're co-creating the future of pediatric chronic pain research together. We have Carly and her mom are two of our kind of 7 patient and parent partners on this team from Ontario, but we have a number of other young adults who have lived experience with chronic pain during childhood, and their parents across the country who are partnering with us as equal members on our team to put a few things forward. So to identify what research priorities patients and families have, to build capacity for greater patient engagement in this area through development of an online patient engagement registry, and to make sure that we're also kind of curating and cultivating how do we do this skillfully. So what kind of things need to happen to move this forward. We also have government stakeholder voice from the Ministry of Health and Long-Term Care in Ontario, and several other patient groups, including Pain BC, who's partnering with us on parts of this project as well, in addition to the traditional researchers, nurses, psychologists, physicians, and so on. So one of the things we're in the process of doing is following a patient priority setting partnership put forward by the James Lind Alliance in the UK, and we're partway through this process. We've done a national survey so far with Canadians living with chronic pain or experience with chronic pain in childhood and their family members and treating care providers. And we're going to go through this process to really emphasize the patient voice, to distill this down to a top 10 list. And these are just some of the ones that have come out of it that you can see here, and many of these have not been adequately touched on by existing science. And the other thing, just through the course of today, I just want to touch on is we've been talking a lot about opioids. And certainly that's important, and I don't want to diminish that, but it's not the only thing patients want to know more about in treating their chronic pain. So I just want to make sure that these other issues that patients and families are identifying, a similar process has been done with adults, that these issues don't get lost. We need to take advantage of that and that discussion around opioids, but there is much, much, much more that patients and families want to know about.
Okay. So good afternoon, everyone. So my name's Carly, and I'm a patient partner, super excited to work with Katie. So in the next couple minutes, I'm just going to give you a little bit of context as to who I am and a couple of key points that I, as a patient partner, have taken with me and help guide how I interact as a patient partner. So for the greater half of my life, I've lived with chronic pain. I was diagnosed with complex regional pain syndrome at the age of 12. And so I've transitioned from a pediatric chronic pain clinic setting into adult care, and I've experienced multitudes of different therapies, treatments, and lived experience over the years. But beyond that, I'm also a person. So I'm also a registered nurse. I'm a cardiac surgical nurse. I am a graduate student at McMaster University with a high interest in pain research. I'm also a daughter, and I'm also a sister. So to kind of elaborate to what we've been talking about today, patients are contextual and complex, and it's not just an illness that defines a person, and in this case, patient partners. I've been very fortunate to have the opportunity to interact as a patient partner, more so in the last 10 years, with everyone on this panel, and I really have to acknowledge of how supportive each one of these panel members have been and helped facilitate my growth as a patient partner. So within the SPORE network, which you'll hear about with Norm's talk, I also sit as a co-chair with Bonnie on the training and mentoring committee, and I've been super excited to work with Katie as well. So a couple of the key points that I wanted to bring forward as a patient partner. So why I gave context as to who I am, the first point I have is that patients are people, and they bring a really great skill set to the table. They bring knowledge, they bring experiences to draw on, and to circle back to what Maria had said this morning, for example, advocacy. My mom is the best advocate I know. Let me tell you, a mother bear with a daughter in pain can move mountains. She's the best advocate I know, and she's worked really hard to help facilitate some of our advocacy within our pain group with Katie. I also think that patient partnership is kind of like a puzzle piece. It's a right fit with the right patient, with the right project, with the right researcher, and it's really about establishing that relationship to really foster growth and really have a meaningful contribution from both patient and researcher. I think then that will also lead to that patient partnership, it's not necessarily a corrective action where patients are correcting researchers and addressing, you're not addressing what patients value, but it's more of an organic relationship where it's a collaboration and a partnership that grows together. And that's one of the things that I've really found to be one of the most influential and beneficial things from being a patient partner. And the last point I wanted to mention was that it's a learning process. With each new experience that I've had as a patient partner, collaborating with different scientists, different clinicians, different leaders, it's a whole new experience with unique challenges, with unique facilitators, as well as barriers that we've had to overcome and work together. And that's really the key in terms of including patients as partners. It's working together, and it's collaborating, and working as a team to have the best outcome possible. So ultimately, where to go from here? We have kind of discussed together. So there's 2 points that we wanted to kind of close with. And my first point is that ultimately it's about being transparent, it's about being supportive, about being communicative, and really working together to make sure that the patient voice is at the table and that the patient voice is heard, because the patient is who you ultimately are affecting and the ones who actually benefit from all of your hard work as clinicians and scientists. So that's the first point.
I think the second point I want to make is, as a clinician and a scientist myself, and a challenge to all of us, this is a behavior change. It's a shift. And I think we need to show up with the right intention, and I think we need to start before we're ready. There's a scholarship around patient engagement that's emerging, but I think we need to, there are patient voices here, they're ready to be engaged, they have lots to say in very meaningful ways, and so we need to take that leap with them and really do that work as we move forward. Thank you.